Hi everyone, thank you for joining us today. Today we will be presenting on immigrant mental health. And my name is Rihanna Ryan. I will be one of the moderators for today's webinar. I will be co-moderating with Deborah, if you want to say hello really quickly.
Hi, everyone. Deborah Levine, Director of the Harlem Health Initiative. It's a pleasure to have our guests, and it's a pleasure to be here today. And congratulations for our new moderators. So we're excited to have this program.
Next slide. So really quickly, we're just going to go over how to use the Q&A feature. So there on the toolbar below, there should be a Q&A button. And then you can type your question into the box at any point during the presentation. You can choose whether you'd like to submit anonymously by checking the box. Only the presenters and host will see these questions. So if you would like to present anonymous or submit anonymously, only no one will know who's essentially asking the question. But yes, that should be available at the bottom of the toolbar if you are interested in submitting there. Um, Next slide. We also want to say a quick thank you to our partners, the Center for Innovation in Mental Health, Harlem Strong, the Center for Immigrant, Refugee, and Global Health, as well as the African Services Committee. Next slide, please. And then going over our webinar agenda, we have our introduction and welcome, which we just briefly sort of went over. Again, I will be one of your moderators. I don't believe I gave a formal introduction, but I am a graduate student here at CUNY-SPH, and I'm also interning with the Harlem Health Initiative. And then obviously Deborah will also be co-moderating with us. She is the director for the CUNY-SPH Harlem Health Initiative. So after this section, we will be going into our presentation from Ansley Hobbs, who is a researcher with CUNY-SERG and CUNY-CIMH. And then we will have our discussion with Natalie Weeks, who is a mental health coordinator with the African Services Committee. We will also have a short Q&A session towards the end, and then we will do our closeout of the webinar. So with that, I think I will go ahead and pass it off to Ansley.
Thanks, Ria. So hi, everybody. My name is Nathalie Hobbs. I'm a fourth-year PhD student at the CUNY School of Public Health, and I work with actually all of your partners. I work as a researcher with CUNY-SERG and with CUNY-CIMH, and I'm a navigator coordinator for Harlem Strong. So wearing many hats, all of them related to this topic area. So it's really nice to be here. I wanted to kind of set the stage for Natalie to talk about, the types of services that they're offering at African Services Committee. So first, we're going to talk about just immigrants on an individual level, kind of what we're seeing in New York City. So we know the things on the screen, right? We know that immigrants in New York who have depression are less likely than their native-born counterparts, US-born counterparts who also have depression. They're just less likely to seek care. There's many reasons for this that we'll get into in later slides. But we also see that PTSD, depression, and anxiety are common concerns for migrant children, right? Many individuals are going through traumatic journeys to get to the United States or through traumatic experiences upon arrival to the United States. So this is sort of the baseline level that people are arriving to New York City, their baseline level of mental health that they're arriving with. So many immigrants are scared actually to get care due to immigration statuses. Oftentimes we'll see families who are mixed status family, even if somebody's eligible for care or, is documented, they still have fear to seek services due to their mixed status families. That's something we see a lot. And then we also see that just generally strenuous work, discrimination, fear, language barriers, these are all types of stressors that we regularly see affecting immigrant populations and their willingness both to actually receive mental health services, but also to kind of acknowledge, mental health issues. So if you want to go into the next slide, we're going to look at a couple of kind of multi-level factors that we really Oh, I skipped ahead in the slide. So here's just quickly a few stats to kind of get you acquainted with this topic area. So students who didn't speak English at home are significantly less likely to get help from school counselors. Sometimes this is due to cultural barriers, this is due to language barriers, but what we know is that immigrants are less likely to seek care. And then also socioeconomic status and poverty levels. These are also deeply associated with mental health generally, but certainly among migrant populations who may be exposed to lower socioeconomic status and a higher poverty level. So among New Yorkers who are born outside of the US, adults with high poverty households are more likely to report depression in the last 2 weeks, right? These are just circumstances of hardship that are likely to drive mental health disparities. And then additionally, we also see that adults with depression who get mental health treatment up here on the right-hand side, we can see the disparity between those who are born outside of the US and those who are born in the US. So almost 50% of US born individuals will seek care for mental health services. That number drops to just 34% when people are born outside of the US. And then again, reiterating that public high school students who got help from a counselor, those who do not speak English at home, were about 4% less likely to seek care or receive care from a counselor than those who speak English at home. Okay, next slide, please. So this is where we're thinking about this on a multi-level immigrant health perspective, right? So there are many, many factors that are driving these mental health disparities beyond, individual experiences. First, there's the overall kind of policy environment that immigrants are both entering into as well as living within. So we know that the policy regime, right, this overarching policy context that an immigrant enters into in the United States has a huge impact on their long-term trajectory for mental health, right? So the policy regime that somebody enters into can determine whether or not TPS is assigned for their country. It can determine what types of care services that they have access to, right? We know with our current administration, we saw a huge rollback in the types of services that were available to people with different types of immigration statuses. And so from administration to administration, we see that shift. And as it says under policies, this impacts things like eligibility to public benefits, access to healthcare levels, whether or not there are worker protections for the job that immigrants are employed in, education access opportunities, whether or not somebody is able to get a driver's license, pathways to citizenship, and also just freedom from enforcement and criminalization. This is sort of the environment somebody's within at a policy level. Then when we kind of zoom in a little bit and get to the community level, we also see many factors here that drive immigrant mental health. So thinking about overall integration with labor within the labor market and access to jobs and that ability to get a living wage, right? That's all at a community level. There's also affordable and culturally tailored healthcare services. So in New York City, we're very fortunate in that there are so many individuals who speak such a broad swath of languages here. And so it does open up access a little bit, but we know that there are many critical language shortages for immigrant health or mental health providers. And so that's one of the things that we need to take in mind. Safe, affordable, healthy neighborhoods, right? I think sometimes we've seen individuals who are maybe having a mental health crisis or are dealing with things at home that, for example, are scared to reach out to NYPD because they're scared of immigration enforcement. And so even though we know policy-wise that's supposed to be separate, we can see how that kind of impacts at the community level. And so there's, this non-discrimination against immigrants. There's also a really important factor here. And then finally, proximity to ethnic enclaves, which do provide a lot of protection from mental health disparities. And then finally, at an individual level, as we talked about before, this can be, immigrant mental health can be impacted by legal status, right? Whether or not someone has liminal legality, whether or not their status is changing over time. Also just personal resilience resilience, just a kind of individual factor. Different people have different levels of resilience. There's also health literacy. As I said before, traumatic immigration journeys can have a huge impact on immigrant mental health, as well as traumatic post-arrival journeys, right? Not always does the trauma take place during the journey. Sometimes the trauma takes place after arrival. And then finally, there's socioeconomic status and an identification with social networks. And so within each of these levels, we can see both protective factors as well as factors that might exacerbate immigrant mental health harms. Next slide, please. So looking at kind of the broader picture here, we see some structural determinants in these systems of exclusion. So as I was saying before, immigrant health is really shaped by both these federal and state policies that create these legal hierarchies of who can and can't receive care. So if we're looking at this map from the National Immigration Law Center on the right, you can see how access level for Medicaid or CHIP, right? We're looking specifically at for children here. You can see how much it varies depending on which state somebody lives in. And so this is certainly the same for Medicaid generally, right, for adults. And we know that a lot of time that healthcare access is only extended to undocumented immigrants in limited circumstances. And so that's just one level of exclusion. But then immigration policy also acts as a macro level determinant. Within this shapes access to, our social safety net policies. It shapes access to what kind of legal status somebody is assigned upon arrival, as well as just a larger general stress exposure, right? We know right now that immigrants are feeling much more stressed with a lot of these immigration rates that are happening. And so what's happening in our communities is directly reflective of a lot of the mental health issues that we're seeing in our communities. And speaking to that, immigration enforcement and this anti-immigrant rhetoric really generates chronic stress and can create severe psychological harm and psychological distress. Next slide, please. So just to get us started thinking about what do we do about this. So on an individual level, there's a lot of things that our community level, that our community leaders, our community members can be doing to help. So as public health practitioners, one of the ways that we can help is to start by familiarizing yourself with referral networks and service provider maps. We really hope to provide a more holistic type of care to individuals, right? Not just a one-off referral to a health provider, but making sure that everybody has the food and the shelter and the healthcare and the social services that they need and they deserve and are entitled to. So one area that you can access that, we actually have developed a migrant service provider map through the Immigrant Provider Action Center that we can send a link to after the webinar. But also hosting and attending Know Your Rights trainings. These are frequently offered through organizations like the New York Immigration Coalition and many, many more in your area. So these can actually be hosted by local organizations or individuals who just want to support their community members. In New York City, there is the NYC Ice Watch that they post regular ice activity updates on Instagram. So if you are seeking to kind of look out and monitor where ice is in New York City, this is a good place to do so. And this can just help individuals bring down a stress level by knowing that they're not here right now, right? They're not in my community, they're not in my neighborhood. Additionally, if you know somebody who has to go to an immigration court case, you can attend as an observer. This is to ensure that you have their all of their emergency contact information, you have their family plan in the event that they are detained. We just want to be sure that all of these pieces are in place before an individual goes to court cases at this time. And then finally, get involved in advocating for more protective legislation. I'm really speaking to my public health practitioners here, but we know immigration status is a social determinant of mental health. We know there's a lot of evidence supporting this. And so there are ways that we can get involved and advocate both at a local level, a state level, and at a federal level. And I'll also just get a shout out to Red Cards. These all contain really important information on immigrant rights. I'm holding right now cards in French, Creole, and Spanish, but but I know that they also exist in, I believe, Mandarin Chinese and just a ton of different languages. And so you can actually log on to, it's called peacesupplies.org is one place. I know that there's also, I think it's called Red Card. I'll get the correct email, but I can add that in, where you can go in and order these and get them delivered directly to wherever you're living or working and pass them out within your community. And you can choose which languages you want to highlight. So hopefully that gives us some tools of what we can be doing in this moment in time. But I also want to show some organizations that are offering really critical support right now. So next slide, please. Okay, so these are just a handful of organizations who we've worked with. Of course, African Services Committee is featured prominently, as well as Harlem Strong, but Mixteca, New Immigrant Community Empowerment, these are both really amazing labor organizations for immigrants. And then also all of these on, I guess the second and third levels, these are all offering really broad social services. So New York City Health and Hospitals, of course, has NYC Care, where anybody can get preventative care regardless of their immigration status. CUNY Citizenship Now offers really important legal services for CUNY students. Terra Firma is a federally qualified health center that's located in, I believe, the South Bronx, who, similar to New York City Health and Hospitals, has care available at free or at a sliding scale. Catholic Charities honestly does so much. So many services are really kind of a catch-all for helping individuals. La Colmena is another really wonderful labor organization. And Cabrini Immigrant Health Services and Libertas, these are also organizations who are working within social services and legal aid. So there's a lot of really great organizations both to reach out to as well as plug into. Many of these organizations look for volunteers. So again, if you're looking for ways to get involved, this is a good place to start your outreach to. So with that, I will turn it over to Natalie, who's going to talk about the specific services and experiences that she's had with working in this field at African Services Committee.
Wow. Thank you, Ansley. And hello, everybody. Thank you so much for exhibiting so many of the realities that immigrants face regarding their health overall, but specifically their mental health. That's really appreciated. Before I sort of dive in, I also want to just acknowledge that because I don't know the audience, I don't know you, I just want to make sure that the topics that I'm going to raise and the examples that I intend to share with you may well be experiences you yourselves have had or members of your family, and I just want to make sure that I acknowledge that ahead of time. It also struck me when I first saw Ansley's slides that often, when we are when we're confronted with the dire circumstances that people are living in, and that this data is presented to us, and then we sometimes, speaking for myself, feel incompetent or overwhelmed by the vastness of what's needed. And so it's really hard sometimes to imagine enough ways to improve on these realities and presented to us by these statistics, but we dive in nevertheless, correct? Yeah. So anyway, I did present this kind of thick outline of what I was hoping we could cover today. And I will try to offer some concrete ways that I believe you can make a difference and that will help to expand this capacity of providing really essential, I'm going to say essential every time, services that will lead to improvements in people's mental health, and particularly the huge immigrant community that we are fortunate enough to live with in New York City. So, basically when we educate ourselves, about the signs among many immigrants, that we can sort of identify these signs and understand that they could benefit from an improvement in their overall mental health through a variety of interventions, which I'm going to talk to in a little while. And then also how important it is to familiarize ourselves with the kinds of community resources that are available, which Ansley has already begun to do. And I have some more suggestions about how to go about doing that. And I also want to raise, which is again why I wanted to also mention the sensibility of this topic, but I wanted to touch on a broader variety of traumatic experiences that are presented by so many people that we see here at African Services. And then lastly, talk about something which I know you've covered probably dozens of times already, but again, just making sure that we're including the importance of the ways in which we are culturally, religiously, adept and competent when we are working with immigrant populations. And the agency I'm representing here, which is African Services Committee, I have been involved in this agency as a mental health counselor and now the coordinator of mental health services here for the last, let's see, 13 years. And prior to that, I was a board member for 6 years. So I do have a very long commitment to not just the agency, but the fact that this agency is committed to working with a very broad spectrum of people that we refer to often as the African diaspora. And I just want to emphasize that that is a huge space because it really involves, Africa has 54 countries, just to start. And then the entire Caribbean, we also see many people from South America as well as Central America. So I just want to be clear about that the breadth of this target community. So, that requires a lot more in terms of being sensitive to the variety of cultures, which is a big challenge for organizations. So I guess I want to, just touch on the fact that we've pretty much said that our experience is that among members of immigrant communities, they're less likely to seek what we would officially call and refer to as mental health services. Why? Well, first of all, because people prioritize, usually, meeting their most basic needs. And I'm sure everybody here is familiar with Maslow's pyramid. And so we know that what people who arrive in New York City are most concerned about is shelter, safety, some security, some financial stability. And then what comes after that? Certainly seeking medical attention when that is very clearly needed on the surface. And that can run the whole gamut because we know that that is something that has been happening over the last few years where we've seen pretty significant increases in some of the, most important diseases. And most recently, there's been a lot of discussion about TB, for example. So there are many ways in which it's important that people obtain medical services, which Ansley, you touched on. So all of this is so important. But again, what about mental health? And what is there about the term mental health, let alone the term mental illness, that that makes people run in the opposite direction practically. I mean, so without joking about it, I mean, I'm sure you're all sophisticated enough to know that it's it immediately either frightens or insults people that they may in fact have something wrong with them, right, mentally. And so it's one of the reasons, I mean, in a very basic way, that ever since I've been with African Services, I've always referred to myself as a counselor. Because counseling is somehow a term that is a little less threatening. And it gives you an entree into being able to talk to people. And I've learned that, you know, through some careful and very respectful inquiries, we can obtain information about immigrants' life experiences, which have harmed their overall well-being, their mental health. And then we can begin to try to develop plans together so that we can see if we can, in fact, help improve that state. One of the questions that I have learned to ask after some considerable, you know, careful consideration is, do you believe that you deserve to feel better? And that gives us a way, it's an entree, a way to move forward. So let's start with, I guess you've been able to see my, the goals that I have for this meeting, starting with Roman numeral 1. I think you have it. Let's see, just adding to your knowledge. I don't know if you want to put it up there. But at any rate, my first goal was, in fact, to do something about, you know, finding out, let's see, how did I say this? That I really wanted to make sure that in a real way, you can expand your knowledge of community resources. So I just want to open the box a little bit because Ansley handed you a delicious array of agencies which cover all of the boroughs, by the way. I was very touched that you included La Colmena, which is Staten Island. Ta-da. And by the way, many people don't know that Staten Island has a very significant African population. More than 50,000 Liberians and Sierra Leoneans who have really been populating that borough since the mid-90s when they were experiencing horrendous civil wars. So anyway, the thing is, I'm thinking that this concrete way of trying to do something to just expand your knowledge base. And one, you know, if you're interning or working at an agency, an organization, a parish, I'm not sure, any community-based organization, it's possible that they already have a list of clinics or, you know, any kinds of organizations that they've already been working with, and that it's very important to familiarize ourselves with those lists. But I also want to say that I think it's very important to verify what's available on those lists, because sometimes they've been, I mean, things change. What can you say about the validity of the information that's offered? And by the way, just looking it up on the internet doesn't necessarily give you the full picture or the accurate picture for today. So what is that? That requires work on our parts. I mean, we have to, you know, we have to call, we have to visit, we have to talk to a real person in order to get a really good sense of what's available now. Who's the right person for me to refer to you, to that organization? And then, you know, I mean, I really do believe that it's so important to speak to somebody first before you refer somebody. You be the person to find out what it's like. What's the tone like when you make that call or when you arrive? What do you perceive about the ways in which that particular place or organization or group is going to receive the person or the persons or the families that you would like to refer to them. And there's only one way to find out. So I like to really promote that activity as much as possible. And, then we say reach out to community leaders. So who are our community leaders? Maybe they're politicians. I can go over here on 125th Street and the borough president's office is there. I can go there perhaps and talk to some people. But who are the other leaders? The religious leaders. I could visit I can go to the mosque, I can go to Adventist chapels, I can go to the local church here on 127th Street or the one on 125th Street, the Catholic Church. But I can also find out if there are groups like the Senegalese Society or other groups that have been created for a long time. What are they up to? What are they doing? What are they promoting? How do they welcome people? And then I think, when you're really curious, you can ask questions at the deli, the laundromat, the hair braiders. Who else can you think of? I just think sometimes actually the precinct, because many of the precincts have representatives from Safe Horizon located within the precinct. Safe Horizon is an excellent, outstanding resource. So those are my little tidbits about how to promote that knowledge base, because it's not just a list or something that you got off the internet. Anyway. And then I was going to touch on another area, which is, I guess I referred to it as conventional versus unconventional, approaches to developing mental well-being. So first of all, I'm going to read what I actually wrote, just to be careful that I don't make a mistake here, that conventional evidence-based treatments are essential in our healthcare systems. And I'm assuming that you know exactly what I'm talking about. So I'm talking about licensed clinics, psychiatric emergency rooms, hospitals, state psychiatric centers. So I really want to be sure that we know that that's a very important base. And then I like to allow ourselves to just think out of the box or be guided to move beyond the box of that very essential service capacity. I wish I could ask each one of you, what you think is unconventional in ways of trying to promote mental health, but I'll share some of the experience that we've had here at African Services, and then I've really been fortunate enough to be able to help develop. So one of them, of course, one of them that I'm going to talk about is a short-term counseling program that we've started to do with Columbia University, and it's called IPC, which stands for Interpersonal Counseling. So it's a 5-session opportunity for us to work with people who are primarily experiencing what we've referred to as the most what we see exhibited most often, which is depression and anxiety, which, by the way, are pretty much the two sides of the same coin. And the thing about IPC that we've been doing for the last 2.5 years is that the people who are delivering this service are trained community wellness specialists, and they are, in fact, persons who represent the lived experience of the persons who are in need of the service or seeking the service. And this program, by the way, and this model has been tested in a couple of countries in Africa as well as South America. So we are now in the process of working in conjunction with the State Psychiatric Institute and Columbia in helping them with their research in conducting this here in New York, because we're able to reach a vast number of people I've referred to. And by the way, these community wellness specialists speak, let me see, 5 of them speak 12 languages other than English. So that, because that is something I see Ansley smiling, that's such a key ingredient in being able to meet people where they are. So let's see, we've done, definitely, you've heard the expression perhaps of healing circles. And there's an organization that also is worldwide called Common Threads Project. And we've been working in conjunction with them. And that is an opportunity that is, it's a kind of strict model that's, that is so far has been designed for women, although I believe they're going to start their first men's group in a couple of months. So I'm very happy about that. And that really engages women in not only the opportunity to develop relationships among group members, but to actually create something, primarily through sewing, to create something together, which they will make among themselves. I also want to touch on the open support group model, particularly the LGBTQ support group, which I've been affiliated with since I've been here. We're just celebrating this month our 11th year of operation. And of course, we have closed groups, meaning closed to certain groups of people who commit to coming for maybe 6 sessions and dedicated to a specific subject. And the example I want to offer is a group that was started for women about FGMC, which is female genital mutilation and or cutting. And it's not only for women who've been victimized by that, but also women who have not. And that has been a very, very successful model of assisting somebody who's definitely had a traumatic experience. And also groups for persons living with HIV. We've been doing that forever, and that's also very important. Lastly, I'm just going to talk about something that we call community access and education. And this one maybe will raise your eyebrows, because what it includes is taking people, accompanying people to museums, to all of the parks in New York City, the historical societies, river walks, picnics, botanical gardens, the Math Museum, Rockefeller Christmas Tree, game centers, beaches such as Coney Island, etc. And then if I had more time, I would really like to engage you in asking you, so what do you think that does for people? And what do you think that facilitates? Then the next item on my little list was to talk to you about traumatic experiences. Ansley has already referred to some that are so important, and I might duplicate that list a little bit, but I'm just going to tell you that, you know, immigration, period, is a traumatic experience. Years ago, when I first proposed this idea, many years ago, in a professional setting, I was booed. I think that now it's a pretty legitimate point and perspective, because what happens, I mean, it's what Ansley referred to, the language, the work, the housing, the poverty, the racism, the discrimination, the need for medical treatment, et cetera, et cetera. These are really critical things that happen to people when they come. And I think language and literacy, by the way, which increased, I mean, the number of people who arrived in the last 2.5 years who were not literate was quite high, which to me must be a horrendous experience for anybody. So that's a very real thing. Then the next item I want to talk about is the word loss. So the loss of country, identity, family connection, the inability to return home when somebody is very ill, when somebody in your family dies. And, just the loss of everything that's familiar to you. Food, major issue. Very depressing. And what are you forced to leave home for? What are the reasons why people have to come? We know about the political danger. And by that, we don't mean just war. We mean, association with political organizations, being seen, at a protest, and having your 15-year-old brother shot, the one who's standing right next to you, because you're at a protest. Being a member of LGBTQ of any kind, anywhere, you can't survive. You can't live. You have to leave. There is still enormous stigma against HIV positivity. That is enormous. It's very, very difficult. People need to leave, not just because of the discrimination, and the alienation from family members, but the lack of medication that is really making a difference for them. And of course, the lack of employment at all levels, whether you've got a high education or you have very little education, which of course means also extreme poverty. So these are just some of the ways in which I wanted to talk about that. The harrowing journey, the journey that so many of our immigrants have experienced. It is hard to even imagine that if you fly from Istanbul to Colombia, and then you begin to have to figure out the system that's going to get you to the American border, and people of all ages, as young as 13, 14, and 15, have been doing this by themselves, by the way. And the illness and the deaths that take place on that trip. So what we're talking about professionally is, yes, there are traumatic events that happen, but then there's ongoing trauma that people experience all their lives. If they were rejected because they were too girly in their home countries, they've been experiencing that since they probably were 9 years old. So this is ongoing trauma, which leads to very complex trauma. And that requires professional intervention and support and assistance and ideas. So we've been fortunate at African Services to be able to offer this resource over time. And I'm going to just quickly go to, last but not least, I want to talk a little bit about post-traumatic growth and the capacity to grow and develop resilience. This is a topic that I'm very familiar with, very fond of, and really like to talk about how we can develop, we can help people develop their personal strength and a kind of a new appreciation for life, and belief that there are new possibilities to recapture that energy and strength that they had. There's spiritual growth, and also really helping people to develop positive relationships, maybe new relationships, because that's what they have to do. They have to create new, we could call it family, but we're going to say relationships. So there's really a lot to learn in terms of how to manage our own emotions so that we can survive, basically. So then I do also mention cultural and religious competence. And I know from everything that you've been exposed to how important this is. And I think, we use the word competence. We use many, many different ways of referring to this. And, how do we get it? How do we get it if we don't exactly think we have it? How's it achieved? And I think when persons of the same or similar ethnic, racial, religious, and lived experience, they are the founders, they're the promoters, they're the leaders, and they're the deliverers of the service. Yes, we are fortunate when we have that capacity. One of the things we need to always be aware of, I think, is that we can't necessarily assume that kind of life experience is going to be the deliverer of the humility that we all need to some degree. And so that what is, how do we get that? I think that we get that through open discussion, definitely training, and sharing of experiences among all staff members, and then eventually, bit by bit, or as we say in French, petit à petit, we get to develop this sense of humility about who we are and where we are and with whom are we. And then over time, I think members of various cultures will give us, they give us clues, they give us hints, they give us opportunities to raise our perception, to raise our understanding. We have to be astute. We have to be observant. We have to be careful. We have to be aware. And that will help us deliver what we hope will lead to improved mental health. We can develop greater understanding. We can, if we're curious and if we're patient. And you've been very patient. So now I think I will say thank you very much. I kind of ran through my little outline, and I'm available if you'd like to ask any questions or move forward. Thank you very much.
Thank you so much, Natalie. That was actually perfect timing. We have about 15 minutes or so left for our webinar, so I'll open the space for any questions. If you guys would like to drop them in the chat or use the Q&A feature, or if you would like to come off mute and ask any questions to either of our speakers, please feel free. I do want to say I know there was a couple of issues with the Zoom today and the Eventbrite invitations, so I am very apologetic that I know a lot of you weren't able to join in until later in the meeting or later in the webinar. So I think some of you may have missed Ansley's portion. If we want, we can go back towards maybe the beginning half of the webinar and just go through those slides potentially. But yeah, I do apologize for the technical issues and stuff we've been having today. This webinar will be recorded as well, so this will be up on our YouTube page. So if there is anything that you missed today, please go to our YouTube channel and you will be able to access the full webinar there as well. But yes, again, the space is open for questions.
We'll also be sharing the slide deck. So if folks didn't get an opportunity to see it, Ensley has been gracious enough to allow us to share that information along with the list of all of the links, websites, suggestions that both Natalie and Ensley shared.
I did want to just maybe before we dive into the Q&A, when Natalie was talking about kind of some unconventional approaches to mental well-being, a few organizations were top of mind for me that I did drop those links in the chat. I want to shout out Girls on the Run. This is really a organization that's focused on using running and using activity as a means to get folks to open up, to share, to just be healthier and feel healthier. And also the second one, Sounds of Saving. I love this organization. They essentially approach mental health in a way that they want to make it more accessible for people who don't want to talk about mental health. And so Sounds of Saving, they really try to open up that discussion through music. What kind of music do you like? Why do you like that kind of music? Does it help you to express something, right? And so by getting to know somebody, by getting to know their taste in music, by getting to know why they like that music, we can start to have a greater understanding of, where are they, where is their mental health, and also how can we help them. And so just wanted to give a shout out to those two. And I did also drop the link for Common Threads, which Natalie described already. So just wanted to give those two organizations a shout out.
Thank you. Thank you. Great.
Thank you, Ensley. I'm so glad you brought that up because I was going to suggest also that one of the things that we have seen is also a growth in community gardens and a place that's connected, that's unconventional. So that is another great way if you run a community garden opening that space. It's a great way to learn about different herbs from different places, but it is also a great place for support and a place to breathe.
Yes. You know, I might just add, Deborah, I mean, anything that makes us use our hands, cooking. I mean, what I've heard people describe about how touching the earth, dirt, has been that has incredible, elements in it that really help people feel soothed. So I'm so glad you brought that up. Thank you.
I have a question for Natalie. Natalie, I know that you all have had kind of so many different ways at African Services that you have approached mental health, like you're saying, through cooking, hosting these types of groups. Has there been like a type of maybe unconventional approach that was most popular, that felt like it was kind of the lowest bar to entry for people, who maybe otherwise would be unwilling or hesitant to talk about their mental health?
Well, this
I
isn't
know, tough one,
definitely,
but
no, it's not. I'm going to mention two, definitely not unconventional, but art.
yeah,
And really thinking about art in a very, very broad way. So one of the things that really made a difference is that we bought many masks, blank masks, and we have a lot of materials to decorate. So when a person creates a mask and then puts it on and then tells their story, remarkable.
that sounds empowering, and like what you've painted on the mask becomes a part of the story. That's
Yeah.
really powerful. Yeah. That's actually an approach that in Harlem Strong we've taken as well. We've been partnering with Hope Community. It's just an organization based here in Harlem to do paint and sips. And we just invite the community to come out. We kind of do a guided painting exercise, or people can paint whatever they want. And, we have a little yummy drinks and little mocktails and stuff like that. And just give folks an opportunity to come together, make community, and make some art. And we have definitely seen, I think, some folks that we wouldn't have normally seen at a group had it only been framed as a mental wellness group. And instead, it's folks who are interested in art, but also get this outlet. So definitely couldn't recommend art therapy enough. I've done art therapy and I couldn't
Yes,
recommend it enough in my life. So
of course.
certainly support that.
I'll offer, there's another area, swimming. Swimming.
I do have a question for the two of you before we close out, and that is if you work for an organization that typically doesn't maybe do mental health services, but is seeing an increase in folks asking for help, is there one or two ideas that you have about if I'm a case, like what do I do? Who do I talk to?
Mm.
I could give sort of a short term and a long term answer. So I would say in the short term, um, of course, trying to build out referral networks, as Natalie was saying, not just organizations that you know passively, but preferably organizations that you have a direct contact at, that you can provide a warm handoff. Any organizations who are already providing mental health services, that could be sort of one route to take. I know, though, a lot of organizations are really overwhelmed by caseloads, or perhaps, we're seeing organizations who don't have kind of the the language capacity to serve everyone who speaks all of these different languages. So another approach that is more long-term is something called mental health task sharing. And this is where organizations actually equip themselves with some of the tools that they can use to meet some of the mental health needs of their community immediately. And so, for example, with Harlem Strong, we offer, this sort of mental health task sharing model where Harlem Strong can come in and teach your organizational members essentially how to handle some cases, how to do risk assessments, and understand, does this individual need, a referral to somebody with, more training and in psychology and in mental health than me, or is this something that I could take on, right? If they're maybe needing some stress management skills, maybe they're needing some conflict mediation skills, interpersonal skills. There's a lot of things that providers can do to support mental health practitioners. And so we call it task sharing because you're thinking about, we have our mental health practitioners such as Natalie who are kind of doing the tough work in there, but there's a lot of things that Natalie does that organizations can also do and can support. And that takes a little bit of the load off of Natalie so she can focus more on the work that she's trained for. And we can also provide support in a more immediate way. And so, of course, that requires, some training at organizations, but it does leave you a little bit better equipped in the long term. So that's what I'll throw into the ring. I'm sure, Natalie, you might have some recommendations as well.
That's so terrific. Well, my thought is perhaps it's just another example of what you've talked about in terms of task sharing, but my thought came from, asking our communities, who do they respect? Whom do they respect? And if you could learn who that might be, it might be an imam, or, it might be a pastor. I think it would be so helpful to be able to invite people like that to your agency, if they are in fact open to the idea of accepting that mental health problem, that depression, anxiety is not just because God made it that way for me. I'm trying to be very respectful here because that is an answer that we get 98% of the time. Yes, a person might describe all of the things that they're feeling, and then ultimately they literally will end the paragraph by saying, but, it's because. And I'm not arguing against that, but I would love to have somebody who represents that also help people realize that they have the right, and what I asked you earlier, deserve, do you have the right to actually feel better given everything that has happened? I hope that wasn't too confusing, but try. Thank you.
All right. I think with that, we are almost at the end of our webinar. So I'll begin sort of closing out. I just want to take a minute to thank everyone for joining us today. I believe the opening and closing polls had went up, so please, if you haven't filled out the closing poll, please fill that out before you leave the meeting today. And again, just thank you so much for joining us. Thank you to our speakers for giving such amazing presentations. This has been such an enlightening conversation, and I, as someone who really loves discussing the subject of mental health, this was just really amazing for me, even. And so just thank you everyone for joining. Thank you to our speakers. Thank you to our partners. And yeah, if there's any closing thoughts that anyone wants to provide, please feel free. I think I saw Ansley come off mute really
I
quickly.
was just gonna give a shout out to everybody, just urging you, reminding you, order some red cards, give them out on the streets. It's just one way that you can get involved. It's a light lift. but see, Natalie's got her cards too. These are really helpful. So that is one of the links that we provide and that we'll send in the email. So just be on the lookout for them. So I hope everybody's able to get engaged and advocate and get active in their community. So thank you all.
Yes, we will be sending out a thank you email after this webinar that will have all of the resources that we linked, the slide deck, we will also be sending the YouTube link for this webinar so you can watch the whole thing in case you weren't able to see the first portion. And yeah, with that, thank you again for joining us today, and we will hopefully see you in our next webinar. Thank you.